Hello, and welcome to the 2025 Annual Enrollment Presentation for Non-Medicare Retirees with the Office of Group Benefits. This presentation will go over plan changes and reminders, your responsibilities as an OGB member, your 2025 plan options, how to enroll, wellness and disease management, term life insurance, and contact information. Effective January 1st, 2025, there will be a 6.65% rate increase on the Louisiana Blue, Pelican, and Magnolia plans. There will also be a new term life option effective January 1st of 2025. OGB will begin offering the enhanced basic term life insurance option with a max payout of $15,000 for the primary policyholder. And just a reminder that no action is necessary if you would like to remain in your current OGB health plan for 2025. Now let's go over your responsibilities as an OGB plan member. During annual enrollment, you can do the following things: enroll in a different health plan, increase from basic to enhanced basic term life coverage, drop or add dependents, discontinue OGB term life coverage, or drop to basic or enhanced basic life coverage, or discontinue your OGB coverage. Please keep in mind, if you discontinue your OGB health coverage in retirement, you can't get it back. Now let's go over your plan options for 2025. For our non-Medicare retirees, OGB offers 4 self-insured plans through Louisiana Blue. Those are the Pelican HRA 1000, the Magnolia Local Plus, the Magnolia Open Access, and the Magnolia Local plans. Now let's take a look at some videos about each of these health plans.
The Pelican HRA 1000 health plan has the second lowest monthly premiums of any OGB plan. It offers a health reimbursement account, or HRA. You can use it to pay for health expenses like coinsurance and copays. OGB will fund a set amount in your HRA, about half of your deductible, and use it to pay for your out-of-pocket medical expenses. When you get care, Blue Cross will get the bill and use funds from your HRA to pay your portion. When all the money in your HRA is used up, you will get the bills to pay out of pocket. Any money left over in your HRA at the end of the year stays in your HRA, as long as you remain with the Pelican HRA 1000 plan. This plan has a deductible. Once you reach this amount, OGB will pay 80% of your healthcare costs for in-network providers. It has an out-of-pocket maximum. When you reach it, the plan will pay 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for health care during the plan year. Pelican HRA 1000 uses Blue Cross's large, statewide preferred provider network. And you can access the Blue Cross Blue Shield Association national providers. Pelican HRA 1000 also offers out-of-network coverage, which can be helpful if you travel or need highly specialized care. OGB members who are active employees or retirees can choose Pelican HRA 1000.
Plus has the second highest premiums of the OGB health plans. But in exchange for higher upfront cost, it offers set out-of-pocket costs, which could be lower than other plans. In Magnolia Local Plus, many covered services offer co-payments. This will keep what you pay at the doctor's office or other facilities predictable. There are some services that use coinsurance, including diabetes treatment, dialysis, emergency medical services, and durable medical equipment. These services are subject to a small deductible for active members. Once you reach this amount, OGB will pay a large portion of your healthcare costs for in-network providers. There is no deductible for retirees who retired before March 1st, 2015. Magnolia Local Plus has an out-of-pocket maximum. Once you pay this amount in copayments and coinsurance, OGB will pay for 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for healthcare during the plan year. Magnolia Local Plus uses Blue Cross's large, statewide preferred provider network. And you can access the Blue Cross Blue Shield Association national providers. Magnolia Local Plus does not offer out-of-network coverage. OGB members who are active employees or retirees with or without Medicare can choose Magnolia Local Plus.
Magnolia Open Access combines moderate deductibles with a nationwide network to make it an attractive plan for members who live out of state or travel regularly. However, premiums for the Magnolia Open Access plan are higher than OGB's other plans. Open Access differs from the other Magnolia plans. In Open Access, you will not pay copays at healthcare provider visits. Instead, once you meet your deductible, you will pay coinsurance for most services. Along with a moderate deductible, Magnolia Open Access offers reasonable out-of-pocket maximums to help keep your out-of-pocket costs lower. When you reach your out-of-pocket maximum, OGB will pay 100% of your qualified care. Magnolia Open Access uses Blue Cross's large, statewide preferred provider directory, the Blue Cross and Blue Shield Association National Providers Directory, and out-of-network coverage. Some OGB members can be eligible for Retiree 100 as part of Magnolia Open Access. Retiree 100 coordinates with Medicare to offer additional coverage for extensive hospital bills and physician charges. Members must have Medicare Parts A and B and very high medical costs. OGB members who are active employees or retirees with or without Medicare can choose Magnolia Open Access.
Magnolia Local combines lower monthly premiums with set out-of-pocket costs to create an exciting option for OGB plan members. We can do this by offering select networks powered by the state's largest healthcare providers, Ochsner Health Network, Christus, Baton Rouge General, and the Baton Rouge Clinic. In the Magnolia Local plan, many covered services offer co-payments. This will keep what you pay at the doctor's office or other facilities predictable. There are some services that use coinsurance, including diabetes treatment, dialysis, emergency medical services, and durable medical equipment. These services are subject to a small deductible for active members. Once you reach this amount, OGB will pay a large portion of your healthcare costs for in-network providers. There is no deductible for retirees who retired before March 1st, 2015. Magnolia Local has a low out-of-pocket maximum. Once you pay this amount in copayments and coinsurance, OGB will pay for 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for healthcare during the planned year. Magnolia Local is available to active employees and retired OGB members who live in the New Orleans and North Shore area, Lafayette and Acadiana, and Caddo and Bossier parishes. It is also available to members in the Baton Rouge area. Magnolia Local does not offer out-of-network coverage.
You can learn more about your health plan options on the OGB Annual Enrollment website, which is annualenrollment.groupbenefits.org. Now that you've learned about the health plans available to you in 2025, let's talk about how you can enroll in a new plan or make changes to your current plan. Retired employees can enroll or make changes through one of the following options. If you're going to enroll in a new health plan with the same covered dependents as 2024, you can use the OGB Annual Enrollment portal. You can use the annual enrollment form that was in the enrollment guide you received in the mail, or you can contact OGB directly. If you want to enroll in a health plan with different or new covered dependents than 2024, you will need to reach out to OGB. If you would like to increase or decrease to the enhanced basic term life option, you need to contact OGB. And if you would like to drop your OGB health and or life coverage, you need to contact OGB. And again, if you discontinue your OGB coverage in retirement, you cannot re-enroll in OGB coverage. So you need to make sure that that is the right choice for you. Now, members wishing to change health plans with the same covered dependents as 2024, again, are eligible to use the annual enrollment portal to make their 2025 selection. Using the portal is very simple. You can follow the links from the OGB homepage to the annual enrollment webpage. Once you get there, you will choose step 3, choose your plan, and then you will select the non-LaGov employees and all retirees option. To enter the portal, you will need to enter your last name, your date of birth, the last 4 digits of your social security number, and your zip code. Next, you will need to confirm that your contact information is correct. Then you will make your health plan selection. Once you've made your selection, you can review them and then click confirm to save and view your confirmation page. However, if you made a mistake or you've changed your mind, you can click change to go back and revise your selections. Once you are finished, we encourage that you print, email, or save that confirmation page for your records. Now let's talk about some wellness and disease management options available to our OGB members. The Office of Group Benefits does care about the health and well-being of our members, and that is why we offer several wellness and disease management programs to you. Among those are the Louisiana Blue Care Management Program. Under that program, you have disease management, diabetes care, Omada Health, and Blue 365. We also offer the Live Better Louisiana program. Here are some videos to learn more about each of these programs.
At Louisiana Blue, we know you are stronger than any disease or diagnosis.
Our health coaches can help if you have chronic diseases like asthma, heart disease, or diabetes, rare conditions, high-risk pregnancy, organ or tissue transplant, serious injuries, cancer, obesity, depression, and more. Health coaches offer personalized support, information, and encouragement for your specific health needs. We have nearly 200 in-house clinical professionals, including nurses, dietitians, and social workers. Our health coaches will offer tips to stick to the treatment plan your doctor made for you, work with you on areas where you want to make changes, such as quitting smoking, exercising, eating healthily, or getting preventive care. Send you preventive and wellness care reminders. Work with you and your doctor's office to coordinate care to make it easier for you to find in-network providers for services you need. We have other care management programs available to OGB members as well. OGB members who are pre-diabetic may be eligible for Omada, a 16-week diabetes prevention plan. This digital care program uses proven behavioral science and rich data science to help members lose weight and make healthier choices. All OGB members can take advantage of Blue 365 Premier Health and Wellness discounts. Save on a healthier lifestyle with deals on gym memberships, healthy eating options, financial health, and more. Let's take this journey together.
Live Better Louisiana is OGB's game plan for better health. The Office of Group Benefits and Louisiana Blue sponsor LBL at no extra charge to you. In fact, it can save you money. All primary members, active and retired, with OGB Louisiana Blue health plans can get a Catapult Health checkup through Live Better Louisiana. Members of OGB's Medicare Advantage employer plan cannot take part. You can earn a $120 a year credit on your OGB Louisiana Blue premiums for the next plan year if you complete your Catapult Health Clinic checkup or get a checkup with your primary care doctor and send in a completely filled out PCP form. Clinics are scheduled across the state. You can see them all at timeconfirmed.com/OGB. For more information on Live Better Louisiana, the premium credit, or to download a PCP form, go to lablue.com/OGB, select your health plan, and click Wellness.
Now let's talk about our term life insurance options. OGB offers 3 term life insurance plans through Prudential. Those are the Basic, Enhanced Basic, and the Basic Plus Supplemental Term Life Insurance. You can see on this slide the information about each of those plans and the options available to the employee and their dependents. During the 2024 annual enrollment period, OGB will allow retirees the one-time opportunity to drop from Basic Plus Supplemental coverage to the Enhanced Basic coverage effective January 1st, 2025, without providing evidence of insurability. However, retirees wishing to increase coverage from Basic to the Enhanced Basic or Basic Plus Supplemental are required to provide that evidence of insurability. You can visit the link below or scan this QR code to complete the EOI form online. There are changes that happen to your life insurance at the age of 65 and 70. Plan members enrolled in term life insurance coverage will automatically have a 25% reduction in term life coverage on January 1st following their 65th birthday. Another automatic 25% reduction in coverage will take effect on January 1st following their 70th birthday. Your premium rates will be adjusted accordingly, and you can review the updated premium rate sheets on the OGB website at info.groupbenefits.org/life-insurance. Now let's go over the contact information in case you need to get with one of our vendors or OGB. To reach out to Louisiana Blue, you can call 1-800-392-4089 or visit www.lablue.com/OGB. For CVS Caremark, their number is 1-877-300-1906, or you can reach them at www.caremark.com. If you need to get in touch with OGB, we highly recommend you visit our website, info.groupbenefits.org. It contains a wealth of information for our members. To learn more about your annual enrollment options, we encourage you to visit annualenrollment.groupbenefits.org. We are on social media, and we encourage you to follow us on X, which is formerly known as Twitter. We are at OGB Louisiana. We also have a YouTube channel where you can watch videos about your plan options. That is State of Louisiana Office of Group Benefits. And we are also on Facebook at Louisiana Office of Group Benefits. Our customer service line is 1-800-272-8451. We are available Monday through Friday, 8 a.m. to 4:30 p.m. You can also email customer service at ogb.customerservice@la.gov. We are located in the Claiborne Building, which is in downtown Baton Rouge, behind the state capitol. That address is 1201 North 3rd Street, Suite G159, Baton Rouge, Louisiana 70802. Thank you for watching this presentation. We encourage you to review your options that are in the enrollment guide that was mailed to you. Take action to choose what is best for you and your family, knowing that our staff at OGB are working hard every day to maintain this valuable benefit. We look forward to serving you and your family in 2025.